Hello and welcome to NewsNight, where we talk to major players in Nigeria's journey to development and the issues generated therefrom. I am Ladi Akeredoluale. Thanks for being with us. COVID-19, whether it be the first or the second wave, is still very much with us in Nigeria. A visit to many health facilities show people affected by this pandemic. So what is the federal government's strategy for containment of this new wave? And what is the position with regards to vaccinations? NewsNight talks to the Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwazu. Dr. Ihekwazu, thank you for your time. Welcome to the program. Nice to see you again.
Thank you very much, Larry. Always great to be on your show.
Let me begin with this issue of the second wave and the very latest that we have. For a couple of days, we've been having numbers well above 1,000. At one stage, we even got near to 2,000, 1,964 to be precise. But it seems to have dropped a bit back. Would you say that that is progress, looking at what you can see from the numbers?
Hi, Larry. No, not at all. We've been seeing consistently increasing numbers, literally since around December, just before, and that has continued. At the moment, we don't see any indication that that's going down. In fact, we think as we continue building up our testing capacity, everything is indicative of increased transmission across the country. So, I think the challenge is that the measures, the public health measures that we've been talking about appear to be so difficult for people to implement, and therefore it's likely that we'll continue to see an increased transmission over the next few weeks, unless something radically happens in terms of how we manage ourselves, our society, our activities, and the setups that do lead to increased transmission happening. So there's no magic around this. As long as we continue doing what we're doing, we will continue seeing an increase in cases, unfortunately, in our country.
There's the issue of variants, which has added some level of complication to all of this. When all of this started in 2020, we were dealing basically with one type of COVID-19. But along with the so-called second wave worldwide has come this issue of variants. And just a while ago, the Presidential Task Force on COVID-19, of which you're a member, did confirm that there is a variant, the much scary variant, the UK variant, the South African variant. Which one, first of all, has been found in Nigeria, and what does this portend for our containment strategy?
Thank you, Ladi. This is a very important concept to understand for our viewers. This is an RNA virus, SARS-CoV-2. RNA viruses mutate a lot, so the more transmission happens, the more mutations happen, and mutations are a natural phenomenon for viruses, and more so for RNA viruses, so that there are more and several mutations happening all the time is in itself not surprising. That's exactly what we expect, and we have been following this. Now, as the transmission has increased, proceeded over the last few months, what we have found is there's a particular variant that seems to be associated with increased transmission. So this new variant, out of many new variants, seems to help the virus with the ease with which it moves from one individual to another. And that was first found in the UK, the B117 variant. There have been 3 other, what we now call variants of concern. So this is among the hundreds of new variants. 3 of these have now been seen to be linked with increased transmission. And these have now been called the variants of concern out of the UK, out of South Africa, and out of Brazil. Listen, we don't really know where they came out from, but these are the first countries where they were detected. So once those variants are identified, what other countries try to do is look for those variants among the viruses circulating. And to look for them, you need a diagnostic tool called sequencing. Now, sequencing is really to understand the genomics setup, the gene arrangements within each virus. It's a fairly complex process. We have 3 centers that can do that in Nigeria. Here at the NCDC, the National Nigerian Institute for Medical Research in Lagos, and the biggest of 3 of them is the Africa Center for Excellence in Genomics in Ede, in the southwest of Nigeria. So we started looking for this. And after a series of efforts, we found one of these viruses. It was found by our colleagues in Ede. And in addition, 3 others were found in travelers that had left Nigeria, but were now tested shortly after departure, and their viruses were sequenced. So what we now know is that this variant of concern, the B117 strain, which has been shown to be associated with increased capability for transmission, is definitely circulating in our country. What we cannot say is how much of these new variants are available or circulating in Nigeria. To do that, you need to sequence a lot more. And to increase sequencing capacity is very complex. So we're trying to do a fair bit more than we have done, but there are limits to what we can do. My final point on that, Ladi, is listen, whether the increased transmission in Nigeria is because of the variant strain, or whether it's because of our behaviors towards the end of last year, or a combination of those, the response is no different. We need to really, until we can say, listen, this is when we'll get the vaccines, which we don't know for sure yet, we need to keep pushing on the very important public health measures that we've been talking about. As difficult as they may be, we have no other alternative. And if we don't manage to do this on our own with the measures that are in place, then unfortunately at some point government might be forced to do more. So what we need to do is really continue working within our society, within our communities, to prevent transmission by limiting the opportunity the virus has to jump from one individual to the other. And we can only do that by re-emphasizing all the measures that we've been speaking about for the last 12 months.
I'll come back to the issue of vaccines that you touched on briefly there a bit later on in the conversation. But this time I wanted to talk about the numbers and the issue of clusters. During the first wave of infections in the country, the NCDC, working with its partners, attempted to identify clusters so as to be able to concentrate reaction and strategy as well as resources in those areas to tackle it. Now, with this second wave, are you able to identify some, shall we say, hotspots where the infections seem to be concentrated at any point? Are you able to do that given the numbers and the facts at your disposal?
We are able to some extent. So we can't do it with the level of specificity that we were doing in the first wave because the numbers were fewer. And now we're seeing, for instance, 500 to 800 new cases being detected in Lagos alone every single day. It means that for each of those new cases, the very hardworking colleagues in Lagos State have to identify them and link them into care. So it's an extraordinary amount of work that has to happen. Once they're linked into care, they then have to be provided with a management. They have to be assessed whether they need to come into a facility or whether they can be managed at home. Their contacts need to be identified and followed up. So a lot of work going on. So right now, 80% of all the cases in Nigeria are coming from 5 states. Lagos, FCT, Plateau states, I remember the 4th one. And in these states, really, the challenge is to manage the concentration of cases, make sure they can do the follow-up, enable them to get into care, and then manage it on a statewide level to implement these measures that will reduce transmission. In this case, the 4th state is Kaduna. So with all of these measures, really, it's an extraordinary amount of work. So we can't really go into the specific issues of clusters. However, that's the narrative in the high burden states. In the states with fewer transmission, In the Southeast, for instance, we can almost specify exactly, in some cases, what single social event has led to a series of cases in people that often return to other parts of the country after the Christmas break. So we've identified quite a number of clusters in those states where there's not a lot of transmission, but the travel that happened over the Christmas period and New Year period really led to widespread seeding of these infections back to where people came from. So very complex and differentiated picture in Nigeria. And we have to take each state on its own, support each state in its peculiar circumstances in response to this outbreak.
Now, one of the things that some of those we have spoken to have identified as being possibly responsible for some of the quote and unquote fairly reckless behavior exhibited over the Christmas and New Year period was the announcement that vaccines are now available and that therefore it didn't really matter if you got COVID-19, it was no longer a death sentence. But as you've already pointed out, for those of us in Nigeria, as indeed for some other countries in Africa, that is not immediately imminent, is it?
I think there are two things. Firstly, the incredible amount of science and research. When we look back to last year, I think in 10 years' time, the storyline will be the incredible science. This is really out of science fiction that we were able to develop a vaccine within the period in which they've been developed, and not just one, but 3 have been brought to licensure, and quite a number of others are well on their way to licensure. So exciting science that has happened. In terms of now how the world has organized itself to enable access to these vaccines, unfortunately, there has been a scramble for vaccines where the richer countries in the world have really paid for all the vaccines that have been initially available in the early months of this year. Over the next few months, we will have access to these vaccines. Our colleagues in the National Primary Healthcare Development Agency are working very hard to make sure that we are prepared with the logistics, the distribution, and the supply chain mechanisms and everything needed to actually make sure that the vaccines, once we have them, get into people's arms. But yes, we don't have them yet. No African country has really had any substantial supplies yet. It's the reality of the world that we live in. I hope we learn critical lessons from this and really think on how to invest in all parts of the food chain that lead to vaccine manufacture. People often talk about the manufacturing of vaccine as a goal. Yes, it is a goal, but it really starts from the other end. How much are we investing in science, in education, in building up the scientists, the the technologists, people that understand the various aspects of what it takes to develop a vaccine. This is no easy thing to do. I believe Nigerians can absolutely do it, but we have to, as a society, really think in terms of how do we prepare ourselves for that future. But in the short term, we have a very narrow focus. How to get our hands on whatever vaccines are available right now and make sure we get them into the arms of Nigerians as quickly as possible.
I'm happy you mentioned that, and that speaks to the issue of the logistics as well. As you mentioned, there are 3 main vaccines that are already on the market. There are others that are expected to come onto the market as time goes on. But then when you take a look at the country, you've already mentioned that our investment in the facilities required for storage, distribution, and administration of these vaccines are not quite at the level at which they should be to be able to handle the kind of population that we have. What can you tell us about what is being done in that regard so that when these vaccines become available, we can procure them, we can store them, we can deliver, and we can administer them safely?
Thanks. Because of the really incredibly hard work and persuasive efforts of the leadership of the National Primary Healthcare Development Agency and my colleague Faisal Shrine, has led to the initial access of 100,000 doses of the Pfizer vaccine that we hope will be arriving in Nigeria sometime within the first couple of weeks in February. We know we don't have the logistics to plan our vaccination strategy around that. So that is really the first 100,000 doses to give healthcare workers in a few priority individuals working on the response to restore confidence in the response and make sure people feel empowered to keep pushing. And now, in terms of our major strategy, most of our vaccines will come through a facility called COVAX. This is an alliance between the World Health Organization, Gavi, CEPI, into which Nigeria has bought in. And through that, we expect to cover 20% of the Nigerian population initially, which is 40 million people. It's a lot of people. So NPHCDA is currently planning the logistics and distribution mechanisms for that. You know, we've got a lot of experience in terms of getting vaccines to the arms of people. You know, we've been carrying out polio vaccination campaigns, yellow fever vaccination campaigns for years. Polio is targeted mostly at children, but yellow fever also includes adults. So in terms of the people that need to do the micro-planning, that understand what it takes, the mechanisms, the code rooms at the state level for the vaccines that we're going to use, NPHCDA is very well prepared and even preparing further for this. So the various levels of this preparation, one in the logistics, the distribution, the supply chain, and everything around that. And I'm fairly confident that we will get there. The critical point right now is supply. There is a supply bottleneck globally. Anyone that watches TV will see this. Even the countries that think they have a lot of money are struggling with supply. So there's a supply bottleneck because 6 billion people around the world are struggling to get their hands on these vaccines. We as public health leaders in Nigeria, our role is to do the very best through the available mechanisms. We're working with the COVAX group, as we've said. The federal government of Nigeria is working to enable the financing of the logistics that needs to happen. Our colleagues have been on the media airwaves, encouraging, enabling Nigeria, educating Nigerians on the benefits of vaccination so that when we do lay our hands on these vaccines, there's no problem in getting them into the arms of Nigeria. So yes, I think, you know, 2021 is all about vaccines. In the preparation, in the delivery, everyone is focused on this question. It is sometimes hard to see progress when we're just in the preparatory mode, but I'm really confident that once we get over the supply bottleneck, that we will manage a very efficient rollout of vaccines in Nigeria, led by NPHCDA, just because of the experience they've had in doing this over many, many years.
What would you tell those who are already preparing and those who are already doing the scaremongering of the public about vaccines, those popularly called the anti-vaxxers? What would you tell them using this forum, especially given the fact that, as you said, it seems to be now all about the vaccines and vaccination?
So, you know, Ladi, it's hard to know which of us, but I must say, many of us will not be alive today if not for vaccines. Vaccines are the single most important, most impactful medical intervention ever. It has saved more lives than antibiotics, saved more lives than surgery, saved more lives than any other medical advance you can think of. So really, you know, our work is to make sure people really understand that many of us without vaccines would have died of measles, would have died of yellow fever, would have died of so many infections that we are circulating and that have really been almost stamped out in our lifetimes. You know, it's simply miraculous. If you think about it, you know, that there's no more white polio virus circulating on the African continent today, which Nigeria was the last country to eliminate, and we celebrated that last year. It's a result of vaccination. That no more children will be with paralysis on our streets, begging for alms, is as a result of vaccination. Nothing else has saved more lives. So listen, Larry, I'm really excited about the prospects of vaccines. Over 6 million people in one of the countries has already received this vaccine. We've seen this transform the experience in these countries. So a lot of the narratives and rumors, we expect that to happen. But as soon as we see the impact this will have on our lives, the fact that at some point we will begin to hope to do many of the things we love doing, it's very important that the only pathway to that is through vaccines. Yes, it will not happen immediately because of many factors. The fact that you need to get a certain level of population immunity before we can take off our masks and start shaking hands again. But just the prospect that we can do that again in a few months is really exciting. So, I know we have to educate our people. Leaders across this country have to come up and speak about the prospects of vaccines. And when I say leaders, I'm not just talking about our political leadership. I'm talking about religious leaders, societal leaders, and leaders from every sphere of life. Even people that may not think they're too relevant. But if you have benefited from the joys of having vaccines, we need your voices to help this narrative and to shape the narrative of hope that vaccines bring to us.
Now, but of course, I hate to be the party pooper, if indeed I am. Vaccines are part of the strategy. But as Professor Tomori told me on this program a couple of weeks ago, vaccines do not mean that COVID-19 will simply disappear. So in that regard, what is being done for people to understand that in as much as vaccination is the way to go, they still have to, in the meantime, continue to comply with all the non-pharmaceutical protocols and indeed all the other protocols that have been established by your agency and other agencies as part of the containment strategy for COVID-19?
Yes, this is very important, Laddie, to really communicate with people. The benefits of vaccine is for the population, and we cannot celebrate the benefits until a good enough proportion of the entire population is vaccinated. So if you are vaccinated on your own, really the benefits are really minimal. We have to continue working hard to gain population immunity. Remember, no vaccine is 100% effective, no single vaccine. So even these vaccines are still 95, the best of them, the best estimates are 95% effective. So there will be some breakthrough transmissions. The only benefit we can get ultimately is to reach population level immunity. So when one virus is trying to go from one person to the other, that person is vaccinated, so it can't jump there. It looks for the next person. It can't jump there because that person is vaccinated. And that's when we talk about the concept of herd immunity, where the vaccine, the virus doesn't find individuals that are unvaccinated to jump to. So, but until we get there, like you absolutely rightly said, we have to continue on the other public health measures. Wearing of masks, keeping sufficient distance from each other to prevent the virus from jumping from one person to the other. These are unfortunate inconveniences, if I could call them that we have to manage in order to stay alive. But, Laddie, I think a lot of the narratives around how difficult it is to do this. Sometimes, I'd like to take a few more people. I've seen a few channels, including Channels TV, do some recent, programs going into the hospital wards. I've, in my position, obviously been exposed to many people that have been really critically ill over the last year. And, if anyone really thinks it's inconvenient to wear a mask, I really will not wish on them the other mouth covering that they could be using if they really got infected, because it's an extremely uncomfortable position to be in, to be gasping for air, gasping for oxygen on a hospital bed. So yes, these are inconvenient. It's inconvenient for us not to shake hands, not to hug, not to go out to clubs to dance, not to have the big parties that we love to do. But, it absolutely goes into insignificance when you compare it to the alternative, lying in a hospital bed gasping for air. So I really want to appeal to every Nigerian that we don't want to get to where we've seen some of the other countries get to. We're simply not in a position to deal with that level of medical crisis. So we've got to keep at it and do everything we need to do. And to be honest, some of the measures that we've started doing in our day-to-day lives, especially in our hospitals. I mean, the improvement in infection prevention and control practices and the access to PPEs and the use of face masks and gloves in our hospitals. That's one thing I hope never goes back to normal, because I think we're seeing a gradual transformation in infection prevention and control practices in the use of basic personal protective equipment, in how doctors and patients and nurses relate to each other. And that's one of the changes that's happened in the last 12 months that I hope is sustained in our health sector, because it will not only prevent the transmission of COVID from one person to the other, you're preventing the transmission of many other infectious diseases that will ultimately keep all of us safer. So Professor Tomori was absolutely right. The vaccine is no silver bullet yet. We may get there, so we do have to sustain some of the measures we've put in place over the next few weeks and months and potentially a couple of years.
You've mentioned them, so I'll mention them. Health personnel on the front lines, like yourself. You've talked about it. You've been able to see some of those who have been very badly affected by this, who have had severe cases of COVID-19. Some didn't recover. But medical personnel themselves are becoming increasingly affected, if the reports we have are anything to go by. You've just mentioned the fact that it's becoming more of the regular practice for them to wear all the protective gear and to comply with the best practices and so on. Is there any one or two, there are two reasons or more why you think that from time to time there's this cluster of infections that we've seen in various states affecting particularly medical personnel?
Yeah, Ladi, this is a very important question. You know, the two groups of people most at risk of this virus are family members of people infected and healthcare workers. Healthcare workers are particularly vulnerable because, firstly, they're really exposed to many sick people that you never know if they have the virus initially or not. And secondly, they have to do this every single day of the week. So it requires an extreme level of caution in protecting yourself, in making sure you are wearing your mask and all the other preventive measures that we have to take. And sometimes it's very hard. You know, if a patient comes into your facility and you're not prepared, and that patient really looks like he does need medical attention, it's a very hard decision for colleagues to manage those situations. So I'm not surprised that we've paid a large price, a huge price in our profession, doctors, nurses, laboratory workers, and this is not unique to Nigeria. Really, this is a phenomenon across the country, across the world. And I do hope when we look back to last year, we will all recognize the incredible sacrifice that healthcare workers have made in this response. Yes, we have continued to push out both training approaches, more personal protective equipment. We've managed to maintain the supply chain of these across the entire country. We've pushed state governments to do more, hospitals to do more. And to be honest, I think many of them have risen to the challenge. But, you know, the reality is this is still a respiratory virus. It's very difficult to completely eliminate the risk. And many doctors, nurses have paid the ultimate sacrifice for this virus. Many have had very bad illnesses and recovered from it. So the reality is that these healthcare workers are particularly vulnerable to this virus, and we must do everything possible to protect our healthcare workers because they are the front line of our defense, and really celebrate the great heroes and heroines that have walked on the front lines of this outbreak over the past 12 months. You know, it's very hard every morning when you're doing a job like this to get up the next morning motivated to continue, and knowing the risks that you face, knowing that some of your colleagues have not come back. So this is really a group of people that ultimately we need to absolutely recognize their sacrifices for the country.
You changed the protocol. You adjusted the protocol about contacts and how they are treated. Now, if you are a contact of someone who is a confirmed case, you are immediately put in the category of a suspected case. What's the thinking behind that?
The thinking behind that is to get ahead of this virus, we really need to be more proactive in identifying contacts and making sure the two critical things that happen. Firstly, you're informed and isolated and advised to isolate, so that if you have an early stage infection, you keep it indoors from the very early days, so you're not taking it out. It reduces the chances that you will transmit it to others. We've also lowered the bar in terms of who to test. So immediately you're identified as a contact of a confirmed case, we're trying to offer the test to as many people as possible, so that, again, we identify you early in your clinical journey if you are infected and get you into care. It has two effects. Firstly, it improves your chances of survival and making sure you get access to the best care possible as quickly as possible, but also it prevents you from transmitting to others. So we have both a personal clinical impact, but also a public health impact on transmission. So we're constantly tweaking our policies around every aspect of this virus as we learn new things on a day-to-day basis. And I'm hopeful that with all of these measures, we can maintain and maybe even bend the curve again while working very hard towards the vaccine. So we know that the one intervention that will really we expect to have a significant impact on transmission is the vaccine. But we also know that we're a few months off. And that's why we have to keep adjusting the tools that we do have at the moment, the physical distancing, the wearing of masks, and all these things that we have to keep doing. We go out, we have to, for the most important events, but whenever there's an option, our advice really to all Nigerians is to limit the interaction you have with people. Even if you can reduce it by 50%, you're reducing the chances of your getting this virus by 50%, just by going out less, by doing more virtually, and by accepting some of these inconveniences in the short term for some longer term benefits where we can get together again.
Are you perhaps frustrated then when super spreader events or super spreader venues continue to remain open? Schools have reopened in spite of the PTF advisory against them in many states. The religious institutions are open. The international and domestic airports are opened. The motor parks, event centers, and so on. These are all places where traditionally one would expect quite a number of people to gather whose backgrounds you don't know and whose compliance with the protocols is never 100%. Is this perhaps frustrating for people like you who have to deal with a containment and treatment strategy?
Yeah, yes, Ladi. You know, to answer your question, I really put these venues into two categories. You know, there are venues that we know are important for life to continue, for societies to keep working. We sometimes still have to travel. We can't close schools forever. Education is very important. So these are very difficult decisions. For now, schools have reopened. We may advise them to be closed again. Ultimately, the state governments are very important in these decisions, and the decision that is appropriate for Lagos might not be the same as in Bayelsa or in Taraba or in Sokoto State. So we've got to really work with the executive governors of every state to define what is appropriate for schools. Airlines are also a very difficult sector, but we worked very hard with the aviation industry to mitigate the risks and to enable air travel as safely as possible. Ladi, the most frustrating part for me is when there are events that are not absolutely necessary or barely necessary for survival. You know, you still see huge social events happening across the country, especially over the Christmas period. Despite all our advice, you know, some are even beamed live on TV across the country. And I really wonder whether, you know, what is going on? Has it been a wasted year in terms of the time we have spent every single week? The chair of the Presidential Task Force and secretary to the government of the Federation is on live TV speaking to Nigerians about the need for all of us to work together. And when there are some of these events on TV, we get phone calls here at NCDC that an event is happening there. NCDC should go and do something. See, NCDC is not an enforcement agency, and really, many Nigerians are adults. We must know what we're putting ourselves up against. This virus doesn't recognize social status. It doesn't recognize that you have an important function the next week, so you have to stay alive to do it. We've seen this virus really take lives apart. So these are the most frustrating, when we see events happening that are obviously not critical and can definitely be postponed, especially when these are social events happening in the full view of the rest of Nigerians, very often attended by prominent Nigerians that should be sending a more nuanced message to others. So we still keep hoping that the message gets through. We pray that we don't learn the hard way, and that eventually we will get to a point where we control each other. We have the courage to tell each other that, listen, when my neighbor is doing something, or my church, or my organization, or my brother, or my sister, that, you know, why don't you consider postponing this until a time where it's safer to celebrate again. But at the same time, I completely understand the urge to do so. We're social people. We love being with each other. But the fact is, in order to get back to that life, there are sacrifices that need to be made in the short term. And we all have a role to play in limiting the risk of transmission of this virus.
This may put you on a slippery slope, but I'm going to ask you anyway. There are, of course, those who point to the fact that people like yourselves have spent the last year, the SGF you mentioned, the chair of the PTF, and a whole host of others, talking about this and trying to drum home the same message. But then occasionally you hear from different arms of government, in some cases at the level of the states, in some cases at the level of the local governments, people who talk about not believing in the existence of COVID-19 or the efficacy of a COVID-19 vaccine or the importance of complying with protocols. Now, does this complicate the strategy for containing this pandemic?
Thanks, Ladi. You know, from the very beginning of this outbreak, I have been unambiguous in insistence that we have a science-led response. In my responsibility as the Director General of the Nigeria Center for Disease Control, my role is not to make political decisions. My role is to provide our political leaders the best scientific advice available to me for them to make these decisions, right? We've come under enormous pressure at many times during this outbreak. There was a time there were cures being thrown at us some from Madagascar, some from other places. And we were pushed very hard. We stuck with the science and said, listen, we will give our leaders the best possible scientific advice available. And that was not to use this. The same pressure came with chloroquine and many others. And every time there was popular pressure, WhatsApp videos were flying around. Everybody was very opinionated in terms of what they thought we should or we should not be doing. We have always stuck to the science. And my role is to continue doing that. I will continue providing Nigerians on the best possible scientific justification for every approach that we're taking, whether it's relating to the virus or relating to vaccines. And thankfully, this is not a challenge that we are having on our own in Nigeria. Everywhere across the world, people are having similar challenges. Ultimately, science will solve this. The evolution and development of a vaccine is a piece of scientific work that is, will enable us return to life. So as much, whether we like it or not, whether we believe in it or not, and I really don't talk about this in terms of belief, because belief is a construct of faith. My approach to this is a construct of science. And I understand why viruses exist and why they're transmitted. We started this conversation this evening with a conversation of various strains and mutations. These are evolutions of a living organism, and the response to it will ultimately be using the knowledge that we have in our brains, wherever that has come from, to define a response, and the best response to that we know we're working on is a vaccine. So I think a lot of these things will solve themselves. Yes, there have been unfortunate reactions from different parts, but that's expected. We don't ever expect for our words to be taken as the absolute truth. The fundamental principle on which science is based is that you should always be open to an alternative explanation. So if there's an alternative explanation tomorrow, then we will accept that. But until that is scientifically proven, I will stick with the science as the rationality in terms of how I rationalize what is going on, and in terms of given our political leadership, who ultimately have been elected by Nigerians, the best possible scientific advice I possibly can.
Let me follow that train a little bit further. As a professional in this field, as you've just said, following the science, can you confirm for me and for our viewers, is it true that if you've got COVID-19, if you've been treated for COVID-19, you never actually return to 100%, particularly in the complete functionality of some of the body parts?
So again, the long-term consequences, clinical consequences of this virus, we're still learning a lot about it. There's a new concept basically defined as long COVID. This is recognizing that many individuals that have had a clinical episode tend to have sequelae. So symptoms that don't disappear as quickly as you might anticipate, and basically sometimes have a long-lasting impact on people. Now, one thing to say is these are varied. The level, the intensity of these symptoms and the duration for which they last is very variable. And of course, we will learn more over time, because the longer people survive, the more we learn about this, and then the more we learn on how to deal with it. But there's definitely the emergence of a syndrome that is called long COVID at the moment, that recognizes that some of these symptoms people don't return to full physical activities and strength and capabilities as quickly as you might imagine. Having said that, a vast majority of people, remember, are completely asymptomatic. A vast majority, around 80%, and talking about clinical sequelae are only among those that actually have clinical symptoms in the first place. So among all of those who don't have any symptoms, we also haven't seen any sequelae happening after their infection. So we continue to learn more. As we learn more, we will always keep Nigerians informed on this and how to manage these sequelae. So the key thing is not everyone can go back to work as quickly as they would otherwise have thought that they could.
I must also ask you about this, the whole idea that this is a very expensive pandemic to deal with. The kind of sums of money that are involved in all the things we've spoken about isolation centers, improving the health and testing facilities. Could this be a winning argument for those who are still skeptical about this? The question of cost, the cost of this pandemic. So even if you don't believe it, could it be that the economic cost should enable you to take a look at it and say, look, this is something we really need to do?
Ladi, you know, when the cost of this pandemic ultimately will be calculated, I think the cost, the direct expenses in the health sector interventions will be minimal. Because when you add up the cost of some of the CBN intervention programs right now, directly to small businesses, the lost earnings of industries that have almost shut down altogether. So the cost to the economy is by far greater than the direct cost. So you are absolutely right. And that is why health security is becoming such an important issue and why investing in health security is so important. You know, yes, people have diabetes and high blood pressure, and it's absolutely important to invest in prevention of these other diseases because there's an individual health benefit in preventing them for the individual and for families. But there's nothing else that is disruptive to the economy as much as outbreaks of emerging and re-emerging infections. It's not, because it is not just the health costs, it is the societal and other economic costs. You know, early in this outbreak, early last year, I remember in some of the sessions we had with our leadership in the country, and when discussions were happening in terms of what to do. And of course, I would present the data on infections and new infections and deaths. And our political leadership, of course, took those into a lot of consideration in terms of making the decisions that they had to make. But there were also, we saw data coming in from the economy in terms of what Nigeria's earnings were from our traditional sources of income over the periods in the first 6 months of this year. We saw data coming in from the number of security incidents that were happening across the country because of the economic consequences of the lockdown. So there are many other data streams. We saw data on farmers that could no longer go to farm because of the economic, because of the impacts of the lockdown. So when you talk about the impact of last year in terms of our economy, you will see that it's really widespread. Now, what do we need to do about this? Goes back to one of your earlier questions. We really need a fundamental shift in thinking on how we think about the work that we do at NCDC. That this is not a health sector issue. This is a national security issue. And until we frame it appropriately in that box, and to understand that if we don't do what we need to do to prevent, detect, and respond to emerging infectious diseases, we will continue to pay this price, not just as a country, but as a globe. So there's a lot of thinking happening internationally now in terms of how to improve our capabilities to detect new viruses. How do we build the early warning mechanisms and response infrastructure to respond to these small outbreaks when they happen because of the potential to become big ones and ultimately pandemics, and refocus our investments, our thinking time into these threats for the future. And I am part of some of those global conversations. I want to really push harder for us to have those conversations locally, not just at the federal government level, but at the levels of every state. So we build up our health security architecture across the country and develop a response mechanism that we can be proud of, and which is resilient and able to protect Nigeria way into the future. This really is the vision for the future. And if anything comes out of this terrible pandemic that we're facing, I hope it's a recognition that the infrastructure in terms of lab, infection prevention and control, our strategic stockpile that we're building up in a location here in Abuja, that all of these will not just help us respond to the current outbreak, but really provides the foundation for a future that is much safer for every Nigerian, at least in terms of the threats of emerging and re-emerging infections.
Thank you very much, Dr. Hekwazu. One can only wish you the very best of luck in this task, and hope for the best in this 2021. Thank you for your time.
Thank you, Ladi, and thank you for the great work you guys are doing.
Thank you very much. And that's Newsnight. Thanks for watching. I am Ladi Akiridoluale. We value your feedback, so please get in touch through any of the social media handles now showing on your screen. Goodbye.